get us started.
Okay, so welcome everybody. I just want to briefly go over some of the options you have with interacting with our speakers today. So we have the chat option. Feel free to type in that. You can send to just the panelists or to panelists and attendees, and then everyone can see what you have typed in there. You can also submit questions throughout. You can do that by clicking Q&A at the bottom of your screen, and that those questions will then get sent in, and we can get those answered as the session goes on. And lastly, if you'd like to speak, you can indicate that desire by raising your hand, and then I'll have the option of allowing you to talk, and you can unmute yourself and ask your question or make a comment, whatever you'd like. And I believe that takes care of our Zoom logistics. So I'll turn it over to you.
Thanks, Ronnie. And I think we may make ample use of that speaking, given that we were a small group. Yesterday, I moderated a session. We had about 40 people on the screen. So we tended to just make more use of the raise your hand, and then we just kept answering. But in today's discussion, we really do want to engage with you folks. We anticipated a smaller crowd for this. It's not a theoretical presentation on advances in public health, but we do think it's something that you may find of interest. I'm Norm Taylor, and I've been an advisor and educator for over 40 years. On screen with me are my colleagues in Global Network for Community Safety, a firm we started about almost 6 years ago in response to the growing demand for community safety and well-being type initiatives. I know some of the folks that I see on the screen. Grant, is that you from Australia? Have I got that right? And Jennifer, it's been, yeah, okay. Jennifer, it's been some time since you and I worked together in Toronto. And some of the folks I don't know, Dan's group, probably some of the folks in Edmonton. So we're going to start with just a quick introduction. I'll let my colleagues introduce themselves while I start the share screen and get us ready for moving forward.
Oh, good afternoon.
You go ahead, Brent. Go ahead.
Okay, sorry, Elise. Good afternoon, everybody. I'm Brent Kalinowski. I've come at this a little bit differently as an end user. I was a police officer in Prince Albert, Saskatchewan till I retired, 27 years and change. And earlier on in that, got involved with wanting to do things differently. Then we developed what we called a hub and what subsequently became a situation table in Prince Albert, Saskatchewan, one of the original architects of that with my colleagues here today. From there, now I'm coming at you from North Bay, Ontario. For those of you not familiar with the geography, it's 3 hours north of Toronto, just far enough away from the center of the universe that I don't get that constant pull away. But happy to be here with you today. Very excited to take on this discussion because as initially a police officer, then retired, now an advisor. Most of my life, or our life for that matter, was traveling and speaking to rooms full of people and then changing again to a virtual world. So excited to speak to you about some of that stuff here today.
Excellent. I'm Lisa Taylor, and as my colleagues mentioned, I'm one of the original architects as well of the model. I came at this, my background is in communication, both visual communication, written communication, as well as in strategy and innovation, sort of design thinking. And I came into this working with the province of Saskatchewan originally, and then with the community of Prince Albert. And we worked to build the model, then build ways to replicate the model, and have been working with my colleagues across the country to implement that in a number of communities here in Canada and in the US. And as Brent mentioned, we did a lot of that was traveling. That's us boots on the ground, taking off, going to communities, helping them in person. And of course, what we're here to talk to you today is about how we've adjusted that to be able to deliver this in an online fashion that we think still gets to where we need to be. Very passionate about the model and excited that we've created this and excited to share it with you guys.
Hi, I'm Brandy Gabry, and I've been with the company now for, I guess, about 6 years. I haven't necessarily been able to take part in all of the travel that they do. I'm kind of behind the scenes, I guess. I'm the manager of administration. So I sort of liaise with our clients and act as the registrar for our learning products, getting everybody enrolled and troubleshooting and that sort of thing.
All right, thanks, team. I'll throw to my colleagues periodically. This first half hour or so, we're going to kind of read in the content so you know what this is all about and what we're here to talk about. But we're really looking forward to engaging with you because I think all of us have faced it's a cliche now, an unprecedented year. There's got to be better words to describe 2020 and now 2021. But it certainly threw all of us back on our heels in the work that we do. Just over a year ago, we were in Edinburgh for LEPH number 5. And I remember us all leaving Edinburgh saying, see you in Philadelphia. Who knew that a couple of months later, we would see this shutdown. And, there's so much important work being done. And more of that work needs to be done now more than ever after the year we just had. And so I think some of us, and maybe some of you came to this session curious about how can we do it in a virtual world. For us, our diet for most of my career, and certainly for the last few years, has been airplanes and hotels. Travel about 100,000 miles a year, not uncommon 2 weeks a month to be in far-flung parts of Canada or the US. And you get used to that. And you start thinking that there's one way to do things. People need training. You get on a plane, you show up and you run meetings. But when COVID shut that down a year ago last week for us, we literally had to sit back and say, do we go ahead? Can we do it a different way? And that's what this is about. As we've worked with the province of British Columbia, a number of communities in BC, at their request, they started calling us back in August. And they said, look, okay, we understand that everything had to shut down, but we don't want to wait. We want to keep moving with social innovations, and particularly anything that can improve social equity. Colonial and systemic racism is as much of a problem in BC as anywhere. And, they were seeing a lot of inequities in the way COVID was affecting communities, being piled on top of just the general inequities that are out there. And of course, the drug problem in British Columbia was ground zero in Canada for the opioid crisis, fentanyl, as well as crystal meth. And so harm reduction has been a huge movement in British Columbia. And a lot of our work kind of dovetails with those types of initiatives. So I'm going to start just by on the title slide here, our commitment that we made to the province of British Columbia once we said, yes, we're willing to play, is that we must be able to deliver the necessary training for BC to launch their tables. I'll talk more about what that means in a moment, but with confidence and fidelity. We didn't want to do this if we couldn't do it well. In fact, we spent quite a bit of time in July and August amongst ourselves thinking about whether this was even doable. We want to also, given a post-2020 world, go further in advancing integration, blending community safety and well-being insights with community and agency considerations. And we needed to be able to do this on time, and obviously to pass on a reduced budget to BC since we were no longer looking at airfares and hotels. And finally, we wanted to help British Columbia build and extend safe, efficient, and affordable support solutions. That's what got us going. I'm going to spend for perhaps the uninitiated, if you're not familiar with the table and how it connects to community safety and well-being, a very quick primer, a brief introduction to situation tables. As Brent said, we originally called this the Prince Albert Hub. 10 years ago last month, we launched that hub. It was inspired by work that we saw going on in Glasgow, Scotland, and we knew we had to adapt and interpret it into a Canadian context. The hub moved out of Saskatchewan and into Ontario in about 2012, with focus in Toronto being the first. They've grown that now to about 130 agencies collaborating, serving 8 different neighborhoods of the city. At the center of it is a concept we call acutely elevated risk, which is to say that the table is there to respond pre-crisis. It's not a crisis intervention. It's not an enforcement model. It is about getting that sweet spot when you know that the risks are accumulating and bad things are going to happen, and mobilizing collaborative solutions before they happen, really pulling situations back from the brink. That's what it was designed to do, and it does so very, very effectively. There's been well over 20,000 situations triaged in situation tables operating across Canada and in the US, notably in Massachusetts. And all of them operate, at least the ones that we work with, and we've launched probably about 60% of them ourselves, because we are the original architects and we were the ones who built the first table, through a process that we basically evolved in cooperation with privacy officials that came to be known as the 4-filter model. And the 4-filter model is a disciplined triage model, so that you're very carefully protecting information and privacy, while at the same time recognizing that in circumstances like acutely elevated risk, you not only have the ability to share, you have an obligation to share if people are facing harm. And so this helps practitioners navigate through that triage process very carefully. So we've advised and trained adoptions in over 100 communities in Canada and the US. And I think by last count, we've probably provided training to about 4,000 professionals. Here's how the table works. As I said, it's not about enforcement. It's about connecting individuals and families with the services they need. And the idea is to mobilize a multi-agency immediate support within 24 to 48 hours. The average situation that meets the threshold of AER will be exhibiting at least 6 to 9 composite risk factors. It's not a single risk response. So you'll see people that are facing homelessness, compounded with addiction, compounded with exposure to violence, and possibly failure to meet basic needs, among other things. You might see a family where you have intimate partner violence in the home, combined with inadequate food supply, combined with mental health issues. An AER is almost never 1 or 2 risks, and we've had some that present with as many as 15. The table's a step towards advancing community safety and well-being. Although we launched it with a view to do the immediate intervention process, we always envisioned that the table would contribute more broadly to systemic reform. And I'll talk more about that in a moment. But it's important to note that it's not a new entity. It's not a formally structured organization. It's a very informal but very disciplined conversation. Most tables will meet weekly on a Tuesday morning, some Tuesday and Thursday. The odd ones will meet Wednesday for about 90 minutes. And when I say disciplined, if it's a 90-minute meeting, it's never 91. It's it respects people's time. And it's professionals coming together in their own roles. They never leave their own roles. They never leave their own organizational responsibilities, but they come into a room together, and for a period of 90 minutes, they engage in a triage that in my mind is very analogous to what would happen in an emergency room. The tables typically have 20 to 25 frontline or supervisory members, and they represent the whole panoply of human service and justice agencies. Normally, you'll see people from primary health, mental health, housing and homelessness, addictions workers, social workers, income assistants, educators from the school system, police and corrections, particularly community corrections. And then there's variations with community-based organizations, victim support, people like that will be there. Where did I leave? Okay, I got the right arrow. Now, one of the key things that we learned early on with the original Prince Albert model and in the first emulations that occurred in Saskatchewan and Ontario is how vital it was that people have proper training in the theory and the practice of the table, because it's such a unique triage model, to ensure that fidelity. A lot of that guidance came from privacy commissioners. We ended up working with privacy commissioners right across the country over a period of 2 or 3 years. They helped us create the AER definition. They helped us create the 4-filter model. And ultimately they said, look, this is something we can support, but only if people are trained because what you don't want is people getting careless, and there's a real risk that that could happen. And we've seen tables where people just got a little loose with the information sharing and got away from the discipline. And so what we commit to is trying to make sure that any table that we support does it right. Now, as a bonus, I mentioned the contribution to community safety and well-being. The data that is captured at the table is all de-identified, but it's a very rich and new source of insight because it's capturing risk as it's presented by lived experience, not from the incident data records that we typically use. So most of our data sources tend to be somebody's been arrested, somebody showed up at the ER, somebody got expelled from school. It's an incident that's already occurred. We look at those, and of course, intake can really warp incidents, just like we see with crime data. You know, you can see crime go up in a particular area because you're enforcing more and arresting more. That doesn't necessarily give you an accurate read on where things are really occurring, because if you weren't there, you wouldn't know. And certainly in the situation table, the whole "you don't know what you don't know" is one of the most fundamental principles. People will say, well, we don't see this person on our lens. We don't see them in need of being a priority. We certainly wouldn't move them up the queue. But that's because we're so good at having silos that everyone sees risk through a single lens. What the table allows us to do is to see composite risk in a multi-lens way, and then immediately mobilize a multi-lens or a multidisciplinary approach. Most communities, almost all communities, are using the same risk tracking data. In some provinces, it's been automated to a database. In many, and in BC, we provide them with an Excel spreadsheet that is keyed to those databases for future upload. The result is we now have well over 100 communities with a uniform instrument capturing the composite risk phenomenon, and many communities dashboard that on a monthly basis so they can see which agencies are bringing situations in, which ones are the appropriate lead, who participates, and what are the outcomes. And we can tell you that in about 80% of the situations across the country and in the US, these situations within about 24 to 48 hours end up with connected to services, risk reduced. And that's the goal. You'll get some where intervention is denied, people don't want the help, they might come back later. You get the odd one where it's flatly declined, but it's way more rare than you might think. And in fact, it's phenomenal how when a multi-sector team shows up at someone's door for what we call a door knock, sometimes might be an actual door knock, sometimes it's "I'll meet you in the alley," sometimes it's "I'll meet you in the schoolyard," wherever they can find the person. When they offer support, not enforcement, when they offer creative response, not mandated response, the willingness to accept that support is phenomenal. And so that's about all I'm going to say about the table itself right now, but I want to throw it open. I'm going to throw it to my partners first, and then I'm going to open it up to the room before I move on to talk about what we've had to do to adapt in a virtual world. Any comments, questions, et cetera, with regards to what I've said about the tables? Go ahead. Team, help me out if there's something else you want to.
I'll just add, other people may be thinking that for me as a police officer at the time, it was a literal game changer, you know, realizing that at the time that we had to do something different, that despite our best efforts, crime was still going up. People were just rolling around loose, not with any connections, and the police services are often seen as a catch-all. So we're taking up all of that slack. What we found out very quickly when we had our partners join us and started talking about situations of acute risk, now I've got a team with me, and there's a team of different people supporting the needs of the people that need it, and very quickly learned that they wanted all of those supports. And once they got those supports, we weren't seeing them as a police service. They were connected to the right supports. So that was literally the paradigm shift for me, and a game-changing moment. And to be honest, it's still stuck with me to this day. And not only from policing, educators see kids staying in school if we can get rid of some of the risks that people are bumping into over time, whether that's their familial situation, their home life, things like that. It's a kind of an all hands on deck, but the support there is phenomenal and literally a game changer that changes the landscape for sure.
Yeah, I think I would just touch on one of the really important aspects of it is there's collaborations, and a lot of agencies collaborate now in certain ways, but this approaches it differently and provides a tool for the human service professionals to really navigate through privacy legislation in order to get to those situations that often have fallen through the cracks over time, those who are most marginalized and faced the composite level of risk. So I think that's to me one of the great things about this table, and the reason why it's effective and we're continuing to help people implement it is that it's a tool that helps get to a spot that you can't necessarily get to in other ways we can discuss things in different ways through that structured conversation.
All right, so I don't see any questions from anybody at this point. You've got a sense of what it is that we're delivering. And as I said, we've been doing this for many years now, and always in a manner where we would fly into a city. We would help them with mobilizing, getting all the stakeholders on board. And then we would spend the better part of a week in-depth training for the actual table participants, the chair, the recorders, et cetera. And we were active on that right up until last year. So I'm going to jump ahead here. I'm going to show you this slide. I think it reflects, Lisa designed the slide, so maybe it reflects Lisa's mood last July, but I think it's about where all of us were after the months of from March to July of last year. And it really sets the tone of why we needed to do something differently. As we looked ahead to a post-2020 context, even as much as we knew at that point, we had obviously the COVID pandemic and the recovery, which from last summer we thought was going to be, would already be there, and now we're well into year two. So, but as well, of course, we saw this incredibly acute resurgence of our awareness around social inequity. Certainly the killing of George Floyd brought a lot of that to the forefront, but month after month we saw more of it, and it had the effect of raising similar resurgence of long neglected issues in Canada, and I think in Australia and in Europe as well. And so this led to the defund reform movement. We prefer to talk in terms of rethink and reform, but any excuses for not dealing with systemic racism, colonial racism, I think are long gone and should be. And it means, our thinking was we can't come into a community in a post-2020 world and talk about a clever model like the situation table and remain or allow people to remain blind to the need for systemic reform. And we weren't prepared to do it. And we've seen this in the last few years with some frustration where communities that had embraced the table and, were really well-intentioned, neglected the data and neglected to confront the recurring marginalization that was leading to those risk factors. So, not to get too preachy, but that's something that's pretty important to us to address. Grant, let's hear your question. Ronnie, can you give Grant the opportunity to take the mic?
Sure, just one moment. Okay, he's now allowed to talk and can unmute himself from his end.
You okay to unmute there, Grant, and tell us what you're looking for?
Looks like he's unmuted.
We're not hearing you, Grant. I don't know if you want to type it.
Yeah, seem to recall Dan had mentioned something earlier that he had to allow it, or there's another button.
Oh, he's going to type it. Okay, go ahead. Just while he's typing that, I'll continue around this screen where we have other things happening. Obviously, economic marginalization has increased, and all evidence is that that's going to continue and increase. You know, that we've watched, certainly I've watched through it, my decades in my work, the gap between those who have and those who don't just continue to get wider and more acute. We also have, you know, the political unrest that we saw certainly in the US, and we're seeing it in many locations in Europe, and we can anticipate that this is going to continue. Increasing urgency of environmental concerns. I think anything that people thought was, you know, sort of beyond comprehension. And ultimately, new response options that we're seeing on public health and partner violence, mental health, and substance abuse. Some of you will know that Canada has recently taken strides forward on the diversion approach to substance use. Particularly the province of BC has been the leader in that regard. But the Canadian Association of Chiefs of Police recently announced their support for diversion models. So this all adds to the context of post-2020. So I got Grant's question now. What are our thoughts on how best to influence social culture, societal culture reform to enable and influence change in racial preconceptions? What a hell of a question, Grant. Thank you for that. I'll tell you my thoughts, and I'm going to invite anybody else on the team to comment. But I think, quite frankly, we've been going about it wrong. What we have are very defensive natural responses that occur from the sectors that are thusly accused, whether it's health or policing or whatever. We spend a lot of time telling people, no, we don't, no, we aren't, no, we didn't mean to, when we should be spending more of that time listening. And I honestly think that we're at a point where, and you use the word culture reform, which I think is brilliant. We really, I take a page out of mediation, the alternative dispute resolution, where people start with storytelling. They start with actually listening to one another. And I think the path forward is a much, much higher level of engagement. It's clear the systems haven't been listening. They've been pretending to listen. Those are my thoughts. Anybody else?
I think you said it well there, Norm. I think a big part of it is that the system, and we've talked about this in terms of the table, has evolved, and not necessarily intentionally by any means, but has evolved to serve itself in many ways. So we often look for efficiencies in our systems and ways to streamline processes and what have you. And I think over time, those stories, those challenges that face different groups have been lost. There hasn't been enough intersectionality in the conversations that need to happen in terms of those things. And so there's certainly challenges all throughout, but I think that's one of the pieces as well, is that the system needs to look, and sometimes it might not be the most efficient process, but it will be the one that serves people best. And we need to balance those types of pieces a little bit more, I think.
Yeah, and just to kind of put that all together from my views as coming back as a career policeman and doing what I was doing for a many number of years, which was law enforcement, then moving into more of a holistic collaborative approach to help people get what they need, knowing, it just solidified the idea for me that criminality wasn't operating in isolation. There was many other things that were going on for people, no matter race, creed, beliefs, or what have you. So, and knowing that if they had those supports, they'd be able to shift away. And it really changed and shifted my view of the world, and still does daily, going on, understanding that people have struggles every day. And if they're not met, sometimes they act out or they do different things. But putting it all together, the table, or a collaborative working environment that's away from the big buildings and the agencies, it's more of a personal level and get to understand people. That was a change for me.
Yeah, communication and messaging and listening, storytelling, I think are all really key to that.
Yeah, Grant, you'd appreciate with a policing background in the weeks following the George Floyd situation, as things really began to escalate in the US, we had Canadian police leaders whose reflex response was 100% defensive. No, it's not us. We're not like that. We don't do that. We don't have any systemic racism. We had some who came out and said, I flatly deny the existence of systematic racism. And it just showed how much they weren't listening, because there's a huge difference between systemic and systematic. And but we do have some police leaders who had the courage to step out and say, yeah, it's real and we need to do something different. So I think, you know, we're at that point where pretending to listen isn't good enough. I think we're going to have to confront much deeper methods of getting at this, because we're seeing the consequences of a divisive society in the United States over the last couple of months and elsewhere. And I think it's pretty urgent. So as you can imagine, then the slide that I have on the screen really resonated with our clients, because they were experiencing all of this. And, you know, we said to them, look, yeah, we're ready to continue moving forward with the situation table model and other community safety and well-being initiatives, but only if we're going to be honest with one another, and only if we're going to anchor it in the world that is emerging. The result was that led to multiple shifts that were required in our approach. We said, unless things are better integrated and other collaborative reforms are happening, then this won't work. Thanks, Grant, for your comments. Appreciate that. We need to re-envision our approach to delivery and the nature of our engagement with our clients. We had to consider the methods of delivery, safe and effective, but with continued integrity. So this led us to conceive of a mixed mode suite of both situation table and community safety and wellbeing services. And we've been now working in partnership with select BC communities and their provincial Ministry of Public Safety and the Solicitor General, which they know of as a PSSG. We've been carrying on with that now for the past few months. So really what we want to just kind of outline for you and then hear your thoughts on as is something that might be relevant to you, something that you may be able to apply as well, is we anchored into a mixed mode learning and virtual engagement model, where we combine asynchronous tools using Moodle, for example, as an e-learning system, where you can have computer mediated conferencing, you can post resources, you can create a number of proficiency testing tools, et cetera. So that's the asynchronous side, but we wanted to twin that with virtual engagement, because we do think face-to-face is important. And it's actually been working well for us. And I think all of us online here would recognize our tolerance and our comfort with things like Zoom has advanced very rapidly. And a credit to the technology providers, the latest versions of Microsoft Teams compared to what was there 6 months ago have escalated very, very quickly in terms of their utility. So this is giving us tools that allow greater engagement with people, and without us getting on a plane, can put us in the community. We do a lot of sensing interviews with people. We make sure we get to know the community. So we've maintained that very intimate approach, but using tools to help us get there. We also applied a lot of design thinking to this, and we work in an iterative fashion with the ministry and the initial communities. We did a lot of research and development as to where they were, what their issues are, helped through the sensing interview process, and also looked at any operational considerations in the COVID and post-COVID world and in the transition. And, you know, that's happening to us in real time. We have a couple of communities that were ready to move forward right away. Then all of a sudden there was a spike in their community, which means the service providers are overwhelmed and unable to move forward. So we've had to have a lot of flexibility in terms of how we move forward from there. The result is that we built a curriculum model based on 4 modules. We've always believed that mobilization of what we call system leaders is vital. This goes all the way back to the original work when Dale McPhee was the chief in Prince Albert. Dale had the incredible ability to mobilize his partners to make sure that they understood what they were doing and why they were doing it. And we've continued as we moved into other provinces. We've always said to communities, don't just launch a table if you haven't mobilized your system leaders to understand why you're doing it. So that's our module 1. Module 2 is kind of a new challenge for us, which is to try to create local capacity at an in-depth level. So it's not enough just to train the 25 people that are going to be at the table. If they need coaching, when we've done training in the past, we routinely get emails for the weeks and months after as people try to clarify, they try to fine tune the work at the table. So by building this mentor capacity, we're able to give the community their own in-depth coaches. So it's kind of a coach the coach model. And we have 3 communities right now underway at that level. And it's showing considerable promise in terms of the willingness of people to step up, to get the in-depth learning. And they kind of like the fact that they can then provide support to their colleagues. Ultimately, it's the table participants in module 3, and we call that the briefcase. It's much more heavily reliant on asynchronous tools from our point of view, but now it's enhanced by the virtual and personal engagement of local mentors. So they can get together face to face, or they can get together on Teams meetings, and we'll help them out when and where necessary. But ultimately, it leads to that self-driven capacity where they can launch their table with just a small amount of support from us. Module 4 is still pending, and this is our thinking that there's a lot of work that needs to be done in systemic reform, and we're looking at communities like Prince Rupert, as it mentions there, and others, where we can say, okay, now you've learned from your risk tracking data, what can you do with that? And for those who don't know, the province of Ontario in Canada actually mandated collaborative community safety and wellbeing planning about 2 years ago through the reforms to the Police Services Act. And the first jurisdictions that we know of, other than perhaps New Zealand, who I think implemented a community safety and well-being mandate as well. But this requires every municipality in the province of Ontario to complete a collaborative plan, risk-driven, evidence-driven, to deal collaboratively with community safety and well-being. And it goes so far as to specify who the actors need to be and who needs to be represented in that planning. To us, that's kind of the ideal. And we're in our module 4, we'll be helping more communities move in that direction. We've helped some of that initial CSWB planning in Ontario communities. Very quickly, I won't go into detail, but the core deliverables for BC were the mobilization, as I mentioned, with the system leaders, the mentor development, including guidance for the chair and recorder, a lot of coaching support. We put some pedagogical content in there to help them be effective coaches, etc. And module 3, then the briefcase, which we're making available to the table participants for several months after they do the training, so that they have a site to go back to and air any questions, revisit any material, and particularly as it relates to understanding the privacy considerations and how to mount effective collaborative interventions. And I've already talked a little bit about the pending module around reform. So we proposed this to the province of British Columbia, and their Ministry of Public Safety and Solicitor General had already established a kind of a grant process, and they had been issuing grants in 2017, 2018, 2019 to communities that felt they were ready to embrace the model, and then they would fly us out and we would provide the training. So working with them starting in August, we said, okay, if we can redo this, we can work together on what's a reasonable, affordable pricing model, then we would be ready to offer this to the province of BC and begin to deliver. The ministry embraced it. There was a provincial election in the meantime, and several of the ministries represented at cabinet really endorsed as part of their campaign this type of approach, collaborative community safety and well-being. As I mentioned, it's a natural fit for British Columbia, a leader in collaborative drug and housing strategies, etc. Basically, our model is to work with each adopting community. We have the ministry actively involved, and we look at other BC communities. Again, I won't go into a lot of detail, but we have benefits to each adopting community, most notably that they get all the training they need. They get it well below the original budget scope, and they get to be architects of community safety and wellbeing solutions in their province. For the province itself, they've been able now to, first of all, recognize a savings in their grant process of about 50%, or maybe just a fraction over that. But compared to what they were spending when they had to pay for airfares and hotels and all that kind of stuff, they're now able to mobilize communities at about 50% of that grant level. And the result is a very significant uptake. There are several communities in British Columbia that are active with us now. Several others that are on deck already have their grants approved. So we anticipate engaging with them over the months to come. And then ultimately for all communities in British Columbia, they all have this opportunity. They have the ability to be part of a community of practice. They're getting common training, and they also have the ability now for retraining, because we had already launched 10 or 11 communities in British Columbia, including larger sites like Burnaby and Surrey, larger cities, but also smaller communities like Hope and Terrace and Williams Lake, communities of only 10,000 people. So all of them now have the ability to trade off each other's experience, which really helps what the ministry was after. So that's our partnership model. We come to this now uniquely prepared to respond to these challenges. One of the reasons we took up the invitation to come to LEPH and talk about this is we think that there may be uptake beyond. We are already working with some US communities. We've had a long relationship with, starting with Chelsea, Massachusetts, and Chelsea then kind of parlayed their experience, and we've launched a half a dozen tables in the state of Massachusetts. And we've been hearing from states as diverse as Oregon, Wisconsin, Florida, Texas. So, the one advantage of the virtual model is that it now becomes borderless. And so if there are communities in Europe, in the UK, Australia, New Zealand, that are interested in the experience, because although there are lots of collaboratives, as Lise was saying earlier, this is a very unique model, and it has a particular place to play, role to play in that rapid triage for those people that we know need it most. This is what it looks like. We send this out to them there, so you see the modules laid out and who it's for, so that helps them make the decision. We work with community champions to help mobilize this, and then we're also able to give them some sense of a timeline. And right now we can say optimistically, if a community started from zero, they theoretically could be trained and launch their table in 8 weeks. Truth is, with COVID and the in and out, we're seeing that move from, I think our best case right now, we're probably about 13, 14 weeks with the community of Prince George. They'll likely be the first to launch. Others are in that range. We have one community now that might actually hit the 8 weeks because they're moving fairly quickly. So with that, I'm going to go back to our home screen, and I'm going to stop the actual presentation content. And again, I'll throw to my colleagues first to get us started, but I hope that any of the folks that are there, that you might put up your hand and let us know your thoughts, any questions that you have, et cetera, et cetera. Go ahead.
Just from a practicality standpoint, it was very, to be honest, it was quite a daunting proposition that we proposed to ourselves, to go from what we knew worked very well, traveling and being face to face with people, having good conversations face to face, networking, whether that's over a coffee, over a meal, over a beer. I've done that for many years, to how can we do this virtually, and if we can, and we came to that rather quickly over time. And then as time went on, and development of the suites and the modules, it's looking better and better. And for me, the attractiveness is, and now don't get me wrong, I still like to travel, but it's out of the question now. But someday that'll happen again. For now, there's a real allowance for increased capacity. We can have a number of communities on the go at the same time. There isn't that buffer of traveling across country for the week and not being able to do anybody else until you come back. So the capacity is certainly there, and less travel. So that was very attractive, and it seems to be quite rewarding.
Yeah, I think, Brendan touched on it there. I think one of the challenges for me was how do we make sure we're able to connect with the community and build in that piece of it where we get to ensure that they're getting what they need and we're building that relationship, but through that virtual, because we were no longer able to have those dinners or conversations or chats or what have you. So to me, I think the fact that this technology that COVID sort of thrust into the world and has had to evolve very quickly is one of the key aspects of that. Being able to combine the asynchronous and the synchronous together so that we're able to connect with them face to face and have those dialogues with the mentors, as well as have the asynchronous, like Brent said, it allows us to have that capacity increase, but still maintains that in-person, that personal connection. And then having the mentors on the ground, allows that longevity and the continuity so that knowledge that we embed in those individuals who get a bit more deeper training can stay in the community, so they don't always have to come back to us right away for questions. I think those are some of the things that to me really stood out as an advantage of what we've done, even though, in person is great. This is also really great now that we're able to use these tools.
Brand, maybe talk about the logistics a little bit. Let folks know some of the challenges that you and the communities have had to work through in terms of making this all happen. There are different logistics when it, used to be we just book a flight and show up. Now you've got a lot of work to do.
Yeah, definitely. I think, first of all, I've been quite impressed so far as to the effectiveness of using, a virtual platform. For the mobilization, for instance, I had some concerns. Is it going to seem very, distant? But I think we've had a pretty good, a couple of cases so far where people are really able to get involved, ask their questions. And we do it in 2 hours. As opposed to, you guys can talk more about it, but I think, what did you say, you used to spend about 3/4 of a day or something with these people in the past. And we're only asking for 2 hours. Now, the challenge comes with, there is a lot of information that you would normally have packed into that. And we can't do that in 2 hours, especially with, 60. In some cases, we've got a community now which might have 100 people in that session at a time. So that takes up a lot of time. So that's the asynchronous comes in. But that's a lot of extra work on their part, to sort of sign in and do that. So, it's kind of been a little difficult getting them. We provide the access. I think we've only done a couple communities, but we're looking at about 60% or so of them actually are signing in and doing that pre-reading. But what I'm finding is I don't think that's as important, because they will eventually sign in, and if they don't before, they do after. And in the end, of course, them getting that information is the most important thing. The other side, sorry, I got a scratchy throat. The administrative side is that now that's a lot more people that I need to enroll. We always had an e-learning component. And so I've been used to the signing them up, dealing with the troubleshooting. It's just the higher volume of those people, because the mobilization people, that first initial group of system leaders would not have been included in that. So it's just, getting them involved, which of course there's always going to be logistical issues. There's going to be people who need help with their password, and some larger organizations might have multiple people, but we have just me. So luckily I've been doing that for some time, and it's not too onerous. But as we're doing all of these multiple communities, it's great we can get so many people involved. It just increases the volume. You just have to be ready to anticipate that and respond to it. But so far it's going really well. And I think it's been great, people's involvement and their willingness to, put aside, they're obviously going to need to put a little more time aside than they would have normally. They would have been all done in a day or two, whether it was the mobilization or the table participants. Now we're talking about, we have to spread it out. They've got to do some asynchronous. They've got to have some meetings, face to face. And so just the scheduling, that kind of thing. And that would happen normally whenever you're trying to get, a group of people together. So that's just some of my observations anyways, thus far. Obviously, we're working
One of
on
the One of the things, Brand, that I don't think any of us anticipated, we often have conversations about privacy, and most of them focus on the actual role at the table. But we discovered that the province had very strict privacy rules around e-learning.
Yeah, that's something.
We
Yeah,
had to go through a big assessment of our asynchronous environment in particular. We do not record any of the virtual segments because that would be a violation of people's privacy. So brands had to take special precautions in terms of which things people are registered in terms of maintaining records. And we had to work with our e-learning provider. We have a third-party provider who had to confirm all of the security and privacy measures on our asynchronous environments, because we already have a few hundred people lined up there. So I see our attendee list is dropping. Dan's group in Edmonton and Jennifer, are there any things in particular that you would like us to comment on? Any questions or observations you have? No pressure, but you're welcome to weigh in. We hope that this has had some value for folks. Seeing no hands up, I'm going to suggest this, that anybody that is interested in knowing more, the session's been recorded. If anybody wants to know more, please reach out to us. Our expectations for this session was we were just going to share an adaptive process that was driven by the COVID pandemic, and let folks know that these tools are out there. We're happy to work with anybody if they're looking to adapt for other purposes. I know Edmonton doesn't have a situation table per se, but I know that you've got the Solutions Lab and a number of community safety and wellbeing initiatives that are underway. Go ahead, Dan. You want to speak?
Yep. Can you hear me?
Yes, gotcha.
Perfect. Just making sure. Yeah, thanks, Norm. We've got a lot of things underway. You're right, and a lot of it's based on situation tables, as you're well aware from the Saskatchewan model with Chief McPhee being here, and we're just trying to change the way we do things. In the room with me is Superintendent Scott Jones, happens to be my brother, who's working on our help model, and we're working on a collaborative location where we're going to have a bunch of our partners located together in a building. So this presentation of yours was extremely valuable in working towards the work that we're going to continuously do and work on. So I appreciate it.
Yeah, I mean, you got a big city and you got a surrounding area. There's a lot of folks that you're going to want to reach out to, and don't hesitate to ask if you want us to share any experience we've had with the virtual tools. As Brandy was saying, our expectations, even amongst ourselves, were modest. We weren't sure, we weren't confident that we could do it and that it would work, but early indications are it's actually exceeding our expectations. I think there are ways in which this is providing a superior solution. Certainly, as Brent said, the flexibility, you don't have the restriction of scheduling. We're doing multiple communities simultaneously. And as Lise mentioned, the level of engagement is diverse and mixed, and the result is you're able to address a lot of things for people. I don't think I've met your brother, Scott. I met your brother, Dave, didn't I?
No, Scott's my only brother. Unfortunately, I wish I had a brother, Dave.
Isn't there a Dave Jones?
Dave Jones, yeah, he's the sergeant. We work together, actually.
Okay, that's where I'm. Sorry, Scott. We met in.
Yeah.
It's all good. No worries.
Did we?
The one comment I just would make.
Did we meet in a
In
bar?
Edinburgh, yeah.
Yeah, I thought.
Yeah,
so.
we did meet in the bar in Edinburgh, I think.
Yeah.
Yeah,
There you go.
The one comment I would make, though.
you guys were in the bar. We were just walking by, just to be clear.
That's right.
Obviously, yes. We shouted at you because we had been in the bar too long.
The one thing I would say that's a struggle for us all the time, though, when we start looking at these things, is that just when it comes to substance use disorder and that we are looking, obviously everyone's looking at decriminalization, but having and ensuring our partners are able to step up and provide the needed continuum of care for our individuals who are suffering from opioid use disorder or substance use disorder. And that's kind of a stagnation chasm, if you will, when it comes to our partner agencies.
Well, I think you've hit on, I think that's a huge frontier that we have. We've had conversations with Mike Sir, who I work with on the Drug Action Committee. And, you know, until we see what a real diversion model can look like, with partners engaged and available so that police can in fact move away from the criminalization of it, then I think it all remains a theory. And you know, we took a hard look at Portugal 2 years ago, and we know what can be done. It can't be exactly like Portugal, but there are a lot of ways in which we can move in that direction. But you're right, that's going to take mobilizing a lot of partners and shifting a lot of energy and resources. So there's lots of work to be done there.
You know, one of the things, so with my own research that I've been doing for both my master's degree and my PhD, we have 800 interviews with incarcerated men and women. Roughly 83% of that population uses substances and would self-identify as having substance use disorder or problem with substances. So we started asking them what they need, what they would need from the system. And one of the things that they say overwhelmingly and resoundingly is cognitive behavior therapy as a methodology, because a lot of treatment programs don't address the root cause. And we would be remiss not to realize that substance use disorder and the use of substances is actually symptomatic of trauma. And what we've done is we keep telling people to stop using, but we don't give them any alternatives to address the reason why they're using. In fact, we have one individual in our study, a 34-year-old woman who'd never been in jail before, walked into a bank, robbed said bank, waited for the police, pled guilty on first appearance so she could get treatment in prison, because she'd been on a list for 3 years to get treatment outside, and it didn't look like she was going to get any. So I think we really need to start advocating to our government agencies for increased levels of things like CBT.
And no kidding, you know.
Yeah.
When Lisa and I were doing a lot of work in the province of Saskatchewan, Dale may have told you, or Brian Rector may have told you, Dan, about the experience we had at the Riverside facility in Cincinnati. The most powerful CBT program I've ever seen. 8 hours of programming per resident daily, and contrast that with some of the provincial prisons that Lisa and I went into in our work with the ministry, to see people sitting on a floor staring at a wall, getting like zero programming. So I think there's a huge opportunity there. Your work in this area is so commendable. And for those who don't know, the Journal is really privileged to have published some of Dan's work, and we look forward to doing more. Jennifer, anything to comment on from your experience with the Empowerment Center? Or not, don't want to put you on the spot if you don't want to be on the spot. Nice to see your name there. We worked together on that mental health conference. Hard to believe, but it's 7 years ago. So listen, folks, you know, we're available anytime. We love talking about this stuff and finding solutions. I will say that I think it's had the effect of energizing us a bit. We were pretty flat, as many people were after being locked down for several months. Weren't sure if this stuff could ever get back on board. We have our ups and downs, but I think generally speaking, we're seeing this roll now. And as the team has commented in their own comments, it really does start to look possible, doable, and we're very encouraged. So thank you for taking the time to be with us this afternoon. Thank you, Ronnie, for coordinating for us. And thanks to my colleagues for your always brilliant comments. So I think at that, we'll leave it.
Thank you, everybody.
Anything else, Ronnie?
No, that's perfect. Thank you guys so much.
Okay, take care. We'll see you all again soon.
All right. Take care.